Hello everyone, I am urologist Omar Makaya. The topic we will take today is Exosome's treatment for erectile dysfunction. This is one of the treatments we hear very often on social media these days. What is Exosomes? Which patients is it suitable for? And what do patients who want to have it done need to know? We will have a short video presentation about it. Exosomes are messages that cells send to each other. How do they send these messages? The cells form small vesicles inside themselves and release them through the cell membrane into the bloodstream. And this goes into the bloodstream, causing a movement in another cell. When it reaches that cell, that little vesicle is taken into the cell. What does it take in? What is inside those little vesicles? There are proteins and genetic codes inside these vesicles. These vesicles go and give a healing message to the cell. Usually stem cells secrete these vesicles. Normally we already have these vesicles in our blood. But what do? We give these vesicles to a point very intensively. We expect improvement in the vascular and nerve structure, reduction in calcification and cell regeneration for erectile dysfunction. How is it different from stem cells? In stem cell therapy, you inject the stem cell itself into the system. In exosome treatment, you give small vesicles formed by the stem cell. In fact, you are actually doing a treatment like stem cell therapy. Exosome therapy is currently in its infancy. What will be the differences in exosome therapy in the future? The genetic code transfer put into these small vesicles will be specialized to the vessels or nerves. Or nano-drug particles will be loaded into them. Well, everything is good so far. Well, which patients should this be applied to? It can be applied especially in patients who do not benefit from PDE5 inhibitors or suffer from their side effects when they use them. And if these patients have severe erectile dysfunction and do not want an operation, then the green light for exosomes treatment can be given. Also, patients should definitely know that exosomes treatment does not promise you a guarantee. Secondly, clinical studies are very few and limited. In other words, most of the studies are experimental studies, animal studies, or laboratory studies. These have given very positive results. But the clinical results are not clear at the moment. Does it have side effects? No side effects of exosomes treatment have been detected so far. The results are good in terms of side effects. So what is my experience clinically? There were patients who had positive results in the exosomes treatments I performed in my clinic. But frankly, we also had patients who did not benefit. This should also be told to the patient. But it is already a treatment applied together with other treatments. It can be applied together with drug therapy, testosterone therapy, stem cell therapy. It can be applied together with shock wave therapy. Of course, it is one of the most expensive treatments, but I think it is a promising treatment for the future. This is exosomes treatment for now. We should also add the following about exosomes treatment. In the treatment, it is necessary to collect exosomes, purify them and produce them in standard quantities. Therefore, when you are going to have exosomes treatment, you can ask for the certificate of exosomes treatment. You can ask from which tissue the exosome is produced. You can ask your doctor whether the laboratory producing exosomes has a GMP certificate or not. This is also an important detail. Because exosomes is very popular at the moment, there may be problems with its production and quality. You can contact your doctor about this. Thank you for listening, best regards.